Whenever you're ready, you can go ahead.
All right. Okay, good morning, everyone. I'm Nando Yanika, Chair of the Region of Peel and Chair of our Board of Health. Thank you for being here and for your patience in following the public health measures for entering our regional building. I'm here today with Mayors Brown, Mayor Crombie, and as well as Acting Mayor Joanna Downey from Caledon. As we are seeing in other parts of the world, the reopening of communities must be done carefully and with coordination. So mayors in the Region of Peel are communicating with municipal leaders across the GTA to develop consistent policies on COVID-19 through stage 2 and the eventual stage 3 reopening. This includes developing a consistent policy on the use of masks in indoor public places across the Greater Toronto and Hamilton area known as the GTHA. And I'm very proud all of the mayors and the regional chairs put out a unanimous communique yesterday, and I'm just going to read from it briefly. It read in part, that all the mayors and chairs are committed to working with their local medical officers of health to explore how they can best advance the universal wearing of non-medical masks and face coverings inside businesses and other indoor places where the public gathers, including on transit. This would likely include mandatory face covering in certain circumstances where municipalities may have already adopted. Subject to consultation with the medical officers of health, it is expected that the GTH municipalities will be addressing this matter very, very soon, and for us that is today. So with that, the procedure that we're going to follow is I will be calling our medical officer of health, Dr. Lauren Slow, to come and speak first. Then I will be asking Mayor Brown to speak second on behalf of Brampton, Mayor Crombie to speak next on behalf of Mississauga, and Joanna Downey, Acting Mayor for Caledon. Then I will come back to the podium and open it up to questions. And just for the sake of social distancing, I'm going to ask all of these speakers just to follow one after the other so I don't come back in between and we stick to the social distancing. So with that, Dr. Lauren Slow, our Medical Officer of Health in the Region of Peel.
Thank you, Chair Yanika. Good morning, mayors, and good morning, Peel residents. As of this morning, Peel Public Health has investigated 6,201 cases of COVID-19 in the Region of Peel. Of these, 5,372 have recovered, 308 residents have sadly lost their lives, and 521 cases remain active, including 159 cases in Mississauga, 344 cases in Brampton, and 16 cases in Caledon, with 2 active cases that have resident information pending. This morning we are talking about masks. Since its emergence in January, the science continues to examine how COVID-19 is transmitted. With an understanding that this disease can be transmitted by individuals without symptoms, and while not quite perfectly definitive, the evidence is increasingly suggestive that non-medical masks may play a role in preventing spread, more so if undertaken with the other core 4 behaviors like maintaining distance, washing one's hands, and getting tested and staying home if you feel sick. For this reason, Peel Public Health has strongly recommended the use of non-medical masks where distancing cannot be maintained, based on a form of source control, which protects others from the wearer in case they are brewing a COVID infection. In essence, it's about taking care of each other. Now we remember that a non-medical mask does not replace the other behaviors of distancing, hand washing, etc. We must do all of those as well. Masks must also be worn properly. This means ideally washing your hands before you and after you put on and take off the mask. Ensuring that the mask covers your nose and mouth completely, and not touching or moving the mask until ready to remove it completely. And when you do, please dispose of single-use masks appropriately and clean cloth masks in a washing machine with hot water and detergent once they become damp. Since the observed peak of the pandemic in our community, we have strongly recommended the use of non-medical masks in places where physical distancing is difficult. We have also supported mandates for mask use on transit systems in our region. Today, I am issuing a recommendation that in the absence of further provincial direction, a time-limited regional bylaw should be enacted to require the use of non-medical masks in public places. I know some in our community will welcome this advice and wonder why it was not issued sooner. As always, we have strongly recommended non-medical masks, and my advice is currently predicated on our community context. A month after setting a goal of 0 daily new cases in Peel, we have not yet achieved that goal, though we have seen a trending decline. A regional bylaw that requires the use of non-medical masks in public would further encourage masking in our community, clarify expectations around when and where people should mask, provide a visual reminder to all of us that these are not ordinary times, and also encourage adherence to the other core 4 behaviors. All of this will hopefully move us to our community goal of 0 new daily cases. And ideally, a properly worn non-medical mask should become as indispensable to your outings as your wallet or your keys. I know there are others who may worry about any masking requirements. I want to be clear. This is not intended to be punitive, but rather about bringing clarity to the duty that we have to each other. For those of us who can mask, doing so keeps others safe, especially for those who cannot wear masks, such as children under the age of 2, those with certain medical conditions, or those that are unable to remove a mask without assistance. Any requirement should also provide exemptions to those individuals from masking. And thought must also be given as well to how we ensure those who cannot obtain masks are provided them. Finally, let me be absolutely clear in closing. COVID-19 continues to circulate in the region of Peel and represents a significant threat to health that can flare out of control at any time. The core 4 behaviors of distancing, hand washing, staying home and getting tested when sick, and non-medical masking, when practiced together, remain essential to stopping the spread of this disease in our community. This means for masks, as the added line to stopping spread, it is time to move from a strong recommendation to a requirement in places where physical distancing cannot be maintained, such as indoor public spaces. With that, I offer my thanks, and I will pass it back to Chair Young.
Well, thank you, Dr. Lowe. We have an exceptional medical officer of health in Dr. Lawrence Lowe, and certainly his experience and background with Infectious Disease Canada is an asset for the region of Peel. I want to say we take his recommendation very seriously. I've said from the beginning, it should not be politicians dictating timelines or medical advice. We should be listening to our senior health officials. We should be listening to our physicians, and that's what we've been doing in Peel Region since day 1 of this pandemic, when we have been taking Dr. Lowe's advice, and before Dr. Lowe, Dr. Jessica Hopkins. Yesterday, the GTHA mayors made it very clear that if the province wasn't going to make masks mandatory in large urban municipalities, that we were prepared to. Hearing that the province is not looking at making masks mandatory in large urban municipalities, I feel very strongly that we can't waste any time, that we need to move quickly. Just like Dr. Lowe has made a strong recommendation based on his data, based on medical evidence and research, we can't ignore that. And it's in the news every single day. You look at new studies that have come out in Germany, the ICA study in the city of Jena, in Britain, the Cambridge University study on the use of masks, the U.S. Center for Disease Control, recent study on use of masks. It makes a remarkable difference. It reduces the spread of this virus. And make no mistake about it, it's still circulating in our community. As much as we've made significant progress. We're not at the goal yet. As Dr. Lowe said, we want to see 0 new cases a day, and we continue to see new cases in our community every day. The recommendation of the GTHA mayors was to make sure that we advance the universal wearing of non-medical masks and face coverings inside businesses and other outdoor and other indoor places where there are public gatherings. This is an important elevation of the use of masks. And previously we had announced it would be mandatory on transit, but this is a significant step in terms of ensuring that in indoor public places we have the mandatory use of masks. And we're at a critical time. We're at a critical time in the fight against COVID-19. We must do everything we can to avoid the flare-up of this virus in our community. Masks are not a replacement for physical distancing, as Dr. Lowe has said. Hand hygiene and other public health measures are critical, maintaining physical distancing. Masks are only part of a comprehensive approach in the fight against COVID-19. The cornerstone must be to find, isolate, test, and care for every case, and to trace and quarantine every contact. And I'm confident this can be done. And frankly, if you look at the challenges they've had with reopening the United States, we don't want to see those challenges here. The use of mandatory masks will actually help us have a safe reopening. And for those that are pleased about moving to stage 2, I can't see how it's going to be possible to move to stage 3 and see the type of decline in case counts if we don't have the mandatory use of masks. So we're going to move quickly in the city of Brampton in coordination and in collaboration with our municipal partners in the region of Peel. I have called a special council meeting this Thursday to ratify the medical officers of Medical Officer Health's strong recommendation on the mandatory use of masks in indoor public settings. My goal is that within a week of this passing, it's appropriate to have a 1-week grace period. Within a week, this would be the new standard in the city of Brampton. And I have to say, one of the reasons that we're here together as Peel municipalities and why we had the conference call yesterday with the GTHA mayors is there has to be some consistency. You know, to have one standard in a restaurant in Etobicoke and a few kilometers away, a different standard at a restaurant in Brampton would only confuse the public. It's why we would have preferred this to be mandated from a senior level of government, but we're now working together. We have a very cohesive group of mayors in the GTHA that wants to put public health first, that wants us to get through this battle with COVID-19 in a manner that protects the public. And I believe today's step is necessary to protect the public. On that note, I'm going to introduce my colleague, Mayor Bonnie Crombie from Mississauga.
Thank you, Mayor Brown, and good morning. And I do want to thank Dr. Lowe for his direction and for his ongoing commitment to the health and the safety of the residents in Mississauga and, of course, Peel. I want to thank my colleagues for joining us here today to show solidarity on this issue. And I extend my sincere thanks to the residents of Mississauga for their vigilance, for their sacrifice, and for their hard work over these past 3 months to limit the spread of COVID-19. Our efforts have paid off, but we can't let our guard down now. As our economy reopens and people start to gather again, we inevitably open ourselves up to an increased risk of transmission. We need to remain vigilant. We may be done with the pandemic, but it is not yet done with us. And that's why we're today calling for mandatory masks in all indoor public spaces. In addition to acting on the advice of Dr. Lowe, this is also something that our residents have been asking for. To avoid a large second wave this fall, we need to continue to practice the 4 core behaviors that Dr. Lowe discussed: maintaining safe physical distance, wearing a mask when that is not possible, washing your hands often, and getting tested. when appropriate. Masks by themselves are not the answer, but they are a big part of the equation. We don't want to enforce a bylaw, but we will if necessary. It is our hope that people will do the right thing for their family, for their friends, and for their neighbors. Wear a mask so you don't spread the virus unknowingly to others. Wear a mask to protect someone who may have a child undergoing cancer treatment. Wear a mask because you support local businesses and want them to stay open. Wear a mask to allow more businesses to reopen and for our economy to thrive. We all have a role to play to keep COVID from spreading. I want to be clear that there will be no onus on businesses to provide their customers with a mask, but businesses will have the right to refuse customers if they do not wear a mask, period, full stop. This is already happening in many stores, and many business owners have already taken it upon themselves to make masks mandatory. If we want to beat this virus for good, our behavior will have to change for a little while. I was very pleased to hear last week from our Prime Minister that Canada is now PPE secure, that we have enough domestic supply of masks, that we can safely make them mandatory and not jeopardize the supply chain. We are ready. I want to thank the many Mississauga residents who are already wearing masks when out in public. And I want to thank all of the businesses who are abiding by the rules. You are making reopening and recovery possible. Thank you. And now I'd like to call on Acting Mayor for Caledon, Joanna Downey. Thank you.
Thank you and good morning. On behalf of Mayor Thompson and the town of Caledon, I'd like to relay a brief message. Wearing a mask in public spaces has been proven effective in slowing the spread of COVID-19. As a region, we are coming together to protect the health and well-being of our residents and our communities. Caledon will continue to advocate for the core 4 principles, as we've heard from Dr. Lowe, and they are simple. Stay, keep apart, stay home. Wear a mask in public spaces, wash your hands often, and get tested when necessary. We will continue to communicate the core 4 principles within our community and support our businesses as they move forward with this initiative. Thank you, and I will turn it back to Chair Yanika.
Okay, thank you very much to Mayor Brown, Mayor Crombie, and the councillor on behalf of Mayor Thompson as well. What we'd like to do now is open it up to any questions that we may have here in the room with the press that's here, and I know we've got some by transmission over the phone as well, and I would like to direct them to the appropriate mayor or to Dr. Lowe. So are there any questions at this time?
I have one about enforcement.
Yes.
Who's going to be in charge of enforcing this, and are there going to be any, who's going to be in charge of enforcing this, and are there any fines set, or will there be any fines or punishment of sorts?
Very good, and I'm going to ask both mayors to speak to that. Mayor Brown, if you, and then Mayor Crombie, if they can speak to the enforcement matter.
Thank you, Chair Yanika, and let me say it would be city bylaw that would be enforcing this. The goal with our special council meeting this Thursday is that this could be in effect within a week. This is integral. Obviously, we need to do everything we can to stop the spread of COVID-19, and given the fact that our medical officer of health, Dr. Lawrence Lowe, has said this is a strong recommendation that he believes is necessary to protect the public and our health and to stop in its tracks the spread of this virus, we can't hesitate, and we will be using additional bylaw officers to make sure that this is properly followed and the advice of our top doctor is followed and adhered to.
So we will be enforcing it by municipal bylaw, much as we have with the other emergency measures under COVID-19. I recognize it will be challenging, but we have implemented and imposed other bylaws which are equally difficult to enforce, such as walking your dog on a leash, or in fact the smoking bylaw. Equally difficult, but we want to ensure that people feel that this is their civic duty and that is the right thing to do. And of course, with any bylaw, there will be a penalty involved, but as Mayor Brown has said, there will be a grace period so people become aware of this new bylaw and can act. So education will be foremost with our bylaw officers, as it has been throughout this COVID pandemic. Dr. Lowe, did you want to comment on this effect as it relates to Peel Public Health? Thank you.
Thank you, Mayors. So certainly in respect of bylaw, in respect of enforcing the regulation, there is a recognition that ultimately we are trying to set a clear guideline, clear criteria as to when and where masks should be used. And through the enforcement with our municipal partners, Peel Public Health will work as well through our public health inspectors, who, if they see something, we will also collaborate to ensure as best we can that this is enforced. But ultimately, this is about changing the conversation around non-medical masks in our community and making it very clear as to where they are required to be worn in order to have the most effective impact on the spread of the disease in our community.
And Doctor, one more question for you, if you don't mind. How long do you foresee this being enacted or needed or necessary?
Thank you very much for the question. So my strong recommendation is in respect of this action is that it be continually reevaluated over the course of the summer. And once fall returns, we'll have to continually monitor and see where our case counts are going, what we understand about transmission in our community, and should it come to pass that we are able to relax this, we will. But that is not the context at the time that we're in, and we should absolutely continue to follow this strong requirement to mask in our community.
Doctor, one more. Would there be also a plan for this moving forward for schools in the fall?
Yeah, so certainly I think any guidelines or recommendations around schools will come out of the Ministry of Education in line with the reopening plans, and so I would encourage anyone who's interested in that to follow what is happening at the provincial Ministry of Education level, and we will certainly take our cues from that.
Wanted the opportunity to comment on the sunset as well. So the City of Toronto has indicated that they'll be revisiting the bylaw towards the middle of September, and I think it would be wise to align right across the GTHA, and we'll have the opportunity to revisit it to determine whether or not there's need to continue at that point or if it can be sunsetted.
Thank you. Any other questions? Next question, please. I'll give one last call. Anybody electronically, perhaps by the phone? I was told there might be some on standby.
Question?
Yes, please. And identify yourself and give us your question, please.
Saying, starting 9:60 a.m. This question is for the Region of Peel. In terms of measuring compliance, what indicator and measures is the Region of Peel and Public Health using to see if there's compliance with this new order?
Yeah, I think all the mayors and the regional doctor medical officer can address that in terms of compliance and how we went up. So Dr. Lowe, and then perhaps the two mayors as well.
Thank you very much for the question. We know that there are a lot of publicly conducted surveys by various companies that we will continue to rely on. And similar to other public health units, we will explore the possibility of behavioral surveys to inquire as to how many residents have taken up the possibility of masking. I know that Ottawa Public Health, for example, does this, and so certainly we have throughout the pandemic explored that as a possibility and may deploy it now at this point in time. So stay tuned as we continue to explore that option.
You know, I would just add that I think compliance is not going to be a significant challenge. The public is prepared for this. You know, just last week we had a teletown hall in Brampton where we asked the public if they believed this was a necessary step, and if it was recommended by public health, would they support it? And over 90% of the city, in a teletown hall where we had 10,000 residents on, said absolutely they want to do everything possible to protect public health. And just like we have with the physical distancing guidelines that existed, there is a way to enforce it. And I found initially there was a bit of a challenge, but very quickly the public adapted. I think the vast majority of the public understands that this is a very serious virus and we need serious responses to it. When I look at some of our toughest week in Brampton with bylaw fines was 127 fines. And out of 700,000 people, 127 fines is less than 0.01%. And so the vast majority understands we have to listen to our physicians, we have to listen to the guidance of public health. And I imagine with this new advice, a strong recommendation of mandatory masks for indoor settings is going to be followed in a similar manner.
Thank you. I just wanted to echo that there's a hue and cry among our residents as well that masks be mandatory. People know that it is the right thing to do, and I think that we will self-regulate each other, really. I think there'll be a lot of public pressure that we will put on each other to ensure people are doing the right thing and that everyone wear a mask when they are indoors. Thank you.
Thank you. I'll call one more time for any other questions.
I have a question.
Yes, please, and identify yourself.
My name is Neva Zafar. I'm from The Pointer.
Yes.
So it was a little hard to hear, so I apologize if this was already addressed. But if masks aren't made mandatory in indoor places, how will people with severe respiratory issues who find it difficult to wear a mask be served?
Yes, Dr. Lowe, people with severe respiratory or other medical health issues, how will we be dealing with them and the challenges they may have with wearing a mask? Dr. Lowe.
Thank you, Chair. Thank you, Nita. This is, in fact, out of my strong recommendation. I have made it clear that the recommendation should not apply to children under the age of 2 and also to individuals who have medical conditions that preclude them from wearing a mask. But more importantly, this actually speaks to the need why anyone who is able to wear a mask should really be sticking to this requirement. Ultimately, wearing a mask is about protecting others from you. It's protecting others from your germs. And so not only are you helping to reduce the individuals who aren't able, for whatever reason, to wear a mask. So certainly that's why this requirement is coming forward today, and why I believe that would hopefully cover off and keep those individuals that you're describing protected and exempted, at least from the bylaw. I think all of us doing the right thing together will help to keep our community safe. Thank you.
Thank you. Okay, what I'm going to suggest is, I think I'm going to wrap it up now. I know the mayors and I have another committee meeting to get to. What I do want to do is take this opportunity and close and to thank all of you that are here and working very hard to change your behavior and making the sacrifices that are going to help us get through this pandemic. And on behalf of the mayors and myself, we'd be remiss if we didn't thank once again the frontline workers, the first responders that have given so much to this cause and will continue to do so. And on a personal note, and I want the good people of Mississauga, Brampton, and Caledon to know it, I think it's 100 days now, other than about 4 or 5, that the mayors and I and our team, Dr. Lowe, our CAO, we've convened every day at 5:30 by conference call. I think we missed 2 or 3 high holidays and that was about it. And I want the good people of Mississauga, Brampton, and Caledon to know it is remarkable the efforts that your mayors and your councils have brought forward on this front. The unity, the fact that we're all in this together, their perseverance, they're keeping their eye on the ball. It's just marvelous to see what we've done and the success that it's shown in averting what's happening elsewhere. So I think it appropriate, Madam Mayor, I'd like you, Mayor Brown, and also on behalf of Joanna Downey, on behalf of Caledon, a concluding comment or remark. Mayor Crombie, then Mayor Brown, then Joanna. Mayor Crombie.
Thank you, Matt. Chair Unica, I don't think it's necessary, frankly. I think that we're calling on people to do the right thing. Today, we're here gathered together to ensure that the public knows that wearing masks is the right thing to do, and we are making them mandatory in indoor settings that have public access. So we're calling on our residents, each and every one of us, to bring their masks along with them wherever they go, to their workplaces or in the retail outlets, etc. Because going forward from today, we will be requiring masks to be worn by all people except those who are exempt due to physical limitations or their age. Thank you.
As I said in my opening remarks about this new policy, it can't be politicians deciding on timetables for reopening or for medical advice. This comes from our top doctor we have great confidence in. He's worked with Infectious Disease Canada. He's been a leading health voice in the GTA. When he makes a strong recommendation, we have to listen. This is about a data-driven approach. This is about looking at the science, looking at the medical advice. And the research is now abundantly clear. You look at the recent studies in Germany, in Denmark, in the UK, in the US, and it all shows that the wearing of masks makes a huge difference in combating this virus. And frankly, we'd be letting our residents down if we ignored the medical advice, if we ignored the abundance of research that suggests this will help prevent the spread. And I think of all the vulnerable people in our community. Frankly, we've already had too many fatalities in Canada. Think of your parents, your grandparents. Think of those who have respiratory conditions. We can't afford to lose more of our residents, and I believe this is a step that's going to help us get through this. And frankly, as Mayor Crombie said previously, it could diminish the extent of the second wave. It could help us get to a reopening sooner if we see counts go down. Dr. Lowe said he's hoping for 0 new cases a day. Well, measures like this are going to help us get to that safer ground and a safer environment in Peel Region. So on behalf of the residents of Brampton, I want to thank Dr. Lowe for his exceptional work, and of course Dr. Naveed Mohammed and the team at Osler Health. They're not here today, but I'm grateful that they're pretty consistently the #1 testing hospital system in the province, and we know that testing is so critical in our battle with COVID-19. So whether it's physical distancing, masks, hand hygiene, it's all going to make a difference. These are all integral tools in our battle against COVID-19, and today is an important step to making sure we've pushed this virus back.
Thank you, Chair Anika. As my colleagues have articulated so well, this is about coming together and following what we have in our data. We have all the faith in Dr. Lowe and his work, and I'd like to take the opportunity to thank the entire health team across the region for all of the work that they've been doing through the pandemic. But it's about science and it's about data, and what we know is proven. And it is proven that wearing a mask will slow the spread of COVID-19. As a community, we can come together and we can do this. Thank you very much.
Thank you to all, and that concludes today's presentation. Thank you very much for having been in attendance.